Did you know that more men wish for a larger penis than those who actually wish they were taller? I'm Dr. Rena, a urologist and pelvic surgeon, and today we're going to discuss ways to increase penile girth, along with the evidence-based options that have been studied and are available to enhance penile size. Before we explore those options, it's important to understand why men consider penile enhancement. As I mentioned earlier, research shows that more men desire a longer or bigger penis than those who want increased height. In fact, one study involving 26,000 men found that 45% wanted a larger penis, while only 38% wished to be taller. Some of you might assume that men seek augmentation because they are below average in size. However, studies show that most men pursuing penile enhancement actually fall within normal size ranges. Many of them tend to overestimate what is considered a normal penis size. For example, in a small study, men believed the average flaccid length was about 13 centimeters, which is significantly higher than the true average of around 8 to 10 centimeters. Other research suggests that up to 91% of men feel their penis is either too short or too thin. Now, what about body dysmorphia? This term is often mentioned, and it refers to being overly focused on a perceived flaw in your body, which can lead to compulsive behaviors or obsessive thoughts. However, when researchers looked at men seeking penile augmentation, the rate of body dysmorphia was actually quite low, between 10 and 15%. So it's not that all of these individuals are overly preoccupied, and while we often think of dysmorphia as a poor reason to pursue enhancement, those affected are usually dealing with significant challenges. They often show avoidance behaviors and rely on safety strategies. For example, avoiding situations where they might be seen naked, such as locker rooms or even during intimacy. This level of concern can create enough distress to interfere with sexual function, and unfortunately, it's also linked to very low self-esteem. So, why do men actually seek penile girth enhancement? When you look at the reasons, the most common one is a desire to boost self-confidence. Some men want to improve the appearance of their penis, while others are focused on function. They may feel it will help them better satisfy their partner. Feelings of insecurity or certain medical concerns can also play a role. In many cases, a man's sense of self-worth becomes closely tied to how adequate he believes his genital size is. Because of this, individuals seeking penile augmentation often have complex and deeply personal motivations. Many people comment on my videos and ask, if women can get breast implants, why can't men choose cosmetic enhancement? If you had asked me that a few years ago, I might have said we should focus more on helping people feel confident in themselves, and I still believe that's important. However, there are some men who, even after putting in the effort through therapy and personal growth, continue to struggle. In those situations, if there is solid evidence showing that a procedure is both safe and effective, then enhancement can be a reasonable option to consider. I know when it comes to the data, the first question many of you will ask is, do those online pills or gummies actually work? And I'll tell you right away, there is no scientific evidence showing that any oral supplement can increase penis size. These products are not approved by the U.S. Food and Drug Administration, and they often contain ingredients that aren't even listed on the label, which can sometimes be harmful. Just so you're aware, the natural male enhancement market within the nutraceutical industry is extremely profitable. It's estimated to reach nearly $600 billion by 2025. Now, what about treatments that have actually been studied? In a recent narrative review, researchers examined the available literature and identified 29 studies on penile girth enhancement, covering about 3,500 patients. However, only 5 of those studies included more than 100 participants, meaning most were quite small. In addition, only 10 studies followed patients for more than a year. When you look at all of this together, the overall quality of evidence is considered low, with limited long-term data. Let's begin with the least invasive option, which is a vacuum erection device. I've discussed these before, and while they can temporarily increase penis size by drawing blood into the erectile tissue, they don't produce lasting changes in length or girth. In most studies, the typical use was about 20 minutes, 3 times per week, and the results generally showed no meaningful increase in size, along with low satisfaction rates. The next option is penile traction devices. These work by applying continuous force across tissue to encourage gradual remodeling, similar to how braces are used to adjust the alignment of teeth over time. So studies have shown that when using these traction devices, the early research had men using them daily for about 4 to 6 hours. Those studies did show some increase in length, but not much change in girth, so they may be helpful for length but not really for thickness. The next category, which is still considered minimally invasive, is penile injections. There are several different types, and I've talked about some of the more risky ones before. I'll go over them again here with updated information from newer studies. First, let's talk about autologous fat injections. These have been used in cosmetic procedures for many years. The process involves liposuction, where fat is usually taken from the thigh or abdomen. That fat is then processed and injected under the skin of the penis. In a small study involving 88 men, between 40 and 68 milliliters of fat were injected through a small incision near the head of the penis. This resulted in an average girth increase of about 2.6 centimeters, and for around 60 to 80% of patients, the results lasted up to a year. However, there were complications. About 2.3% of patients experienced issues, and one person even needed additional corrective procedures. Another study showed a similar increase of about 2 centimeters in circumference. But one patient developed nodules, or small lumps, under the skin. This isn't entirely surprising because fat cells, called adipocytes, don't always survive well when placed into highly vascular areas. They can break down, leading to fat necrosis, which may cause cosmetic problems. In fact, another study that looked more closely at complications found irregular fat lumps, skin deformities, scarring, and even cases where the penile skin shifted downward toward the scrotum. A small number of patients also reported changes in sensation. More concerning, there was a case where a man died from what's known as a fat embolism shortly after the injection. Because of these risks, this is not something I would recommend, as there are safer options available and the potential complications can be quite serious. The next substance is silicone. Silicone started being used as early as the 1940s and 1960s, and its use for penile girth enhancement began around the 1970s, typically in the form of liquid injectable silicone. However, the body can react negatively to silicone. What has been observed in these cases is significant swelling, distortion, and the development of something called silicone granulomas. Over time, many of these men also experienced sexual dysfunction, and in some cases, these problems appeared as long as 30 years after the injection. Because of this, silicone is not recommended, as there is still no proven safe method for its use. There has been something called a microdroplet technique, where very small amounts of silicone are injected monthly in tiny volumes. But this has only been studied in small groups and lacks strong long-term follow-up or reliable results. Now, what about fillers? Fillers are commonly used in other parts of the body, like the face and lips, so it's natural to ask if they can be used for penile enhancement as well. The most commonly used filler in this area is hyaluronic acid. Early approaches involved a single, larger volume injection, around 20 milliliters, and this did show a noticeable increase in girth, from about 7.5 centimeters to 11.3 centimeters. Complications were generally low, but some men reported reduced sensation and felt their erections were less firm, likely because hyaluronic acid has a softer consistency. More recently, practitioners have shifted toward using smaller amounts of hyaluronic acid more frequently to achieve the desired increase in girth while trying to minimize the issue of reduced sensation. However, it's important to understand that these fillers are not permanent and tend to break down over time, meaning the effect can diminish. Another type of filler that has been used is polymethyl methacrylate. This material is non-absorbable, and studies have shown it can increase both girth and, to a smaller extent, length. On average, girth increased by about 2.4 centimeters, while length increased by slightly less than 1 centimeter. This may be because the material is firmer, which can give the appearance of added length as well. However, despite seeing improvements in size, there were also frequent issues reported. About half of the patients developed problems like nodules, ridges, and indentations. If someone wanted to have the material removed because they were unhappy with how it looked, it turned out to be very difficult. Removal could lead to deformity, erectile dysfunction, pain during intercourse, and even fibrosis of the erectile tissue. On top of that, these studies don't offer strong long-term follow-up, and their results haven't been consistently reproduced. Now, what about surgery? Surgical options have also been explored, but complication rates vary widely. Some studies report rates as low as 8.6%, while others go as high as 100%. The most common complications include swelling, scar formation, skin necrosis, ulcers, wound infections, and in some cases, the need for additional surgeries. So, what kinds of procedures are actually being done? The most common surgical approach involves grafting. In one study, surgeons used a graft taken from the groin area that included dermis and subcutaneous fat. The idea is to increase tissue bulk and improve blood supply, so the graft integrates well with the surrounding tissue. In that study of 11 patients, there was an increase in girth of about 2 to 2.5 centimeters. However, complications were fairly high. 7 out of 11 patients experienced swelling, pain during erections, temporary curvature, and general discomfort. In another study involving 69 men, instead of using the patient's own tissue, surgeons used a porcine dermal acellular graft. This was inserted through a small incision at the base of the penis in the infrapubic region. Again, girth increased by about 2 to 3 centimeters. However, 13 patients developed fibrosis of the graft, which actually led to penile shortening of up to half a centimeter. Clearly not an ideal outcome. Another option that has been discussed before is the penuma implant. While earlier published data seemed somewhat promising, more recent reports have shown that an increasing number of patients are requiring revision surgery after receiving this implant, and the device itself has also undergone modifications over time. In response to these concerns, modifications have been made to try to lower the risk of complications. However, one challenge with this type of cosmetic surgery is that patients often don't return to the original surgeon if problems arise. They tend to seek care elsewhere. So, when it comes to the penuma implant, as I mentioned earlier, there have been reports of complications that required reconstructive surgery afterward. The true rate of these issues is still unclear. The final surgical option that has been studied is called corporal augmentation phalloplasty. In this procedure, surgeons take vein grafts from the saphenous vein, commonly used in heart surgery, and attach them directly to the corporal or erectile tissue. This was evaluated in a small study of about 39 patients, where they observed an increase in diameter of roughly 1.3 centimeters. However, this increase was only seen during erections and not in the flaccid state. Additionally, nearly 40% of patients experienced temporary curvature, although it resolved within about 3 months. This is a fairly invasive procedure for penile girth enhancement, and overall, the available research is quite limited. There is currently no clear expert consensus or standardized guideline on the best approach for safely increasing penile girth. As I mentioned before, complications are likely underreported, partly because many patients don't return to the original providers who performed their procedures, and these treatments are still largely considered experimental. If you're seriously thinking about pursuing any of these options, I strongly encourage you to do thorough research and carefully weigh the potential risks before moving forward with any type of penile enhancement. And as always, take good care of yourself. because you truly are worth it.